So the reason Yomi makes it minimally invasive is because it is a cutting edge technology, but more importantly without the cutting. We don't have to necessarily open up big flaps. We don't have to cut too much of tissue to get access to the bone and the underlying bone. And that makes a lot of sense because post-operatively, since there's minimal cutting, recovery is really quick and easy. Patients are not complaining too much of post-operative discomfort. I mean, as a comparison, if a person needs to get a heart procedure done, imagine getting a big sternal incision and getting a heart procedure done versus just making a few holes to get the heart procedure done. You can imagine the level and the time of recovery compared to both those procedures. Just like that, if you're doing either a freehand implant placement for a full arch transition or a static guide, you still had to explore and make big flaps. That really causes a lot of inflammation. When you're causing inflammation, it's going to have post-operative discomfort. So minimal invasive procedures are the mantra for today. Quick recovery, easy, and patient acceptance really goes sky up. So that's a huge advantage. And so that's why I wanted to get into this cutting edge technology. And I was actually the first 30 pioneering surgeons in the country to adopt this technology in the office. If I had to do a preparation for this procedure, and if I used like static guides or something, I had to do was, take an intraoral scan, get a CT scan, upload all of that and send it to a local lab. And that lab will help me basically create a static guide, which I would use on the day of surgery. But that would take 4 or 5 days, or sometimes even a week to get back to me, and the patient had to wait. And imagine if this was a front tooth, then the patient had to wait for about a week or so before they would get it to us. And that was one part of the equation. The second part of the equation was that if you did a freehand full arch reconstruction, that would take hours to put it together. The advantage here is that robotic surgery is actually the day off. If a patient comes for a consultation to me today with a broken front tooth, I can actually get into surgery within minutes, finish up with the procedure in a few minutes, and actually patient leaves the office with some kind of a transitional prosthesis within about 45 minutes to an hour. So that is about efficiency and accuracy. Added to that, safety. So why wouldn't you say yes to Yomi? Because it has all the advantages and security at different layers of the procedure, and that is significant. And if you just depended on either freehand surgery or static guides actually control the surgery for you. What that means is that if that guide did not fit, you either go back to a free-handed procedure or you have to abandon the procedure for that day. With the robotic systems, you can actually change your surgical protocol on the fly, and which is the biggest advantage I've seen. That's why my adaptation to this technology, I have transitioned all of my implant surgeries to 100% robotic surgical procedures, because why not give the patient that extra advantage for better safety, better security, quick and efficient, and more importantly, a minimally invasive option for them.